Hello, hi, this is Dr. Michael Watson here to talk to you a little bit about obstructive sleep apnea surgery, and specifically what options there are for you and also what we offer to see if maybe this is something you are interested in, or at a minimum, maybe this just helps you learn a little bit more about what your options are out there. As always, brief summary here, not all inclusive. For more information, head over to azjawsurgery.com. Give us a shout, reach out to us via phone or email if we can help, if you'd like to schedule a virtual or in-person consultation to discuss this further. So what is sleep apnea, or specifically what is obstructive sleep apnea? And there's important things to discuss when we're talking about what it is. First and foremost, what has to be emphasized is that it is a life-shortening condition, meaning it will both take off quality and quantity of life. The quality of your life with this condition, if left untreated, will be less. You will not be the same person if you have untreated sleep apnea, nor will you be that person for as long. We know this condition will literally take years off of your life and is associated with a number of other medical conditions that it's thought to potentially cause or contribute to the development of. So, untreated sleep apnea, more likely to make you obese, more likely to give you diabetes, hypertension or high blood pressure, high cholesterol, heart disease, stroke, other neurovascular and cardiovascular events. Again, just something that should not be left untreated, whether that's treated with surgery or not, up to you, but should not be left unchecked. So what is it? Essentially, your anatomy as the patient with obstructive sleep apnea is such that when you go to sleep, there's collapse of your airway. Contributing factors can be body habitus. Are you a larger person? The position of your jaws, how big is your nose, how wide your nose, how big is your palate, how big are your tonsils, whole host of factors that come into this that make the anatomy of the patient important. But essentially your anatomy, when relaxed and lying down and asleep, causes collapse of your airway to where you're not sufficiently moving air to ventilate and supply your tissues with adequate oxygenation. This also disrupts your sleep cycles, which in of itself is problematic to your overall health. This is often as described as if you were drowning multiple times throughout the night. So you think about it, if you've ever been in a near drowning experience where your body just goes crazy, your heart rate goes crazy, you're flailing. It's a huge kind of release of adrenaline to save yourself. And you're going through that multiple times a night instead of resting peacefully through normal sleep cycles. And it's a huge detriment to your overall health. So how do we treat it? There's a number of options, and these should always be presented to you if you're meeting with someone to diagnose and treat your sleep apnea, because what works for one person or is best for one person is not always what's best for the next. CPAP, however, generally should be the first line treatment for patients. They should almost always, unless there's a specific reason not to, they should always try CPAP. And there's a number of reasons for this. One is it's not invasive. It's very benign. You're wearing a mask, it's strapped to your face. That's not always pleasant, but it doesn't require surgery. There's not risk associated with it. There's also very good diagnostic information that comes from this. And what I mean by that is, let's say you think your daytime sleepiness and your lack of concentration and a lot of your symptoms are because you have sleep apnea. Well, this gives us a way to improve upon your sleep apnea and see how you respond. So let's say you're on CPAP for 3 months and it's working fine. All the readings are great. We've basically treated your sleep apnea. You're sleeping as if you don't have it. But let's say you still have all those other symptoms that brought you to seek out treatment. Well, that's hugely beneficial for us to diagnose and maybe give recommendations, and for you to, as the patient, to make decisions. Because why would we subject you to further treatment, more invasive procedures, more risky procedures, more cost and time and recovery if we're going to do that and you're not actually going to see a clinical response? So why treat you if you're not going to get better? So treating you with this first, even if you don't love it, like it, and you want to go on to other options, it at least gives us information to how you'll respond to an improvement in your sleep apnea treatment. Because we don't want to put you through other things if you're not actually going to see subjective improvement. That's not doing anyone any good, least of all you, the patient. So positives and negatives of this: non-invasive, safe, quick, usually covered by insurance. Insurance, you can always tell that something needs to be treated whether or not insurance covers it, right? So insurance knows that this will cause heart disease, obesity, diabetes, all these other things that they don't want to pay for down the road. or as much for down the road. So they would much rather treat your sleep apnea. So they are almost always going to cover sleep apnea treatment, and especially, especially CPAP. The downsides to CPAP are it does require something to be strapped to your face. That's important both for compliance, meaning no one can make you do it. You have to do it. And it's not necessarily the most comfortable thing. If you're claustrophobic or if you shift a lot in your sleep, it does make noise. If you have a bed partner, this will generally be much more quiet than your snoring, and your bed partner will generally like this much better, but it's not completely noise-free. The hose bends, moves. It does cause some noise and unrest, but it's usually generally much better than not having it. If you have to travel, well, you got to take it with you. There's a social stigma to this. If you're young and you have roommates or you're single, having a CPAP at your bedside is not always the best thing for you for that reason. And then you do have reusable supplies and maintenance, like you have to take care of it. You have to have a new mask every so often. You have to check your hose. You have to change filters. You have to fill up the container. There's some maintenance that comes along with it. And if you're the kind of person who doesn't do well with that stuff, this may not be the best long-term option for you. Alternatives, oral appliances. So these are devices generally made of plastic, sometimes have some metal components. As you can see kind of over here, I'll move my picture so you can see a little bit better. The whole functionality of these is they sit on your teeth and they allow your lower jaw to be pulled forward. So they move your lower jaw forward, which then opens up your airway in the oral airway, and that's an important distinction. It doesn't do anything for your nasal airway, so if you have obstructions in your nose, this is not going to help those. It's only if you're orally obstructive, which is where most of the majority of the larger obstructions do come from. So the positives of this, again, non-invasive. It's not a surgery. It's not a procedure. There's not like acute surgical risk that comes along with it, and it's mostly safe. You do need to be working with someone who does this a lot, knows what they're doing, because it can cause problems. And there's a number of different types of appliances. Some are more likely to cause certain problems than others. Those problems can be movement of your teeth. So again, there's force being put on your teeth to move your jaw forward. That can cause movement of your teeth, like orthodontically. That's essentially how orthodontics works, is slow, low-grade continuous force on your teeth, which is what this requires to move your jaw forward. Your jaw is also being put in an unnatural position. It's being cranked forward, for lack of a better explanation. That can cause TMJ and jaw soreness issues. Again, most of the time when you wear these, you have exercises or even another splint that you're supposed to wear when you wake up in the morning to help counteract those forces, but it can cause those. So if you have a history of TMJ issues, this is generally not always a good option for you, or something that needs to be monitored carefully for potential exacerbation of those things. It's replaceable. So if you outgrow it, it gets damaged, it's broken, your dog eats it, which we laugh about, but actually happens frequently, you can replace it. Now, that's not always cheap or easy, but it can be done. It's much easier to travel with, because people have orthodontics and wear retainers and other things, it's generally a little bit more socially acceptable, to where, again, most people may not even know you have it in your mouth if you didn't explain it to them. Downsides, we touched on, again, you still have to wear it. So there's a compliance component of it. If you're not the most compliant person, if you don't think, hey, I'm not going to clean this and wear it, and I'm not going to do my exercises and maintenance that prevent me from having TMJ issues or other things, like, this is probably not the best option for you. It's not always cheap. Depending on what's made and how many times you have to make it, there's cost associated with it. And again, you have to follow up and monitor. What if we move your jaw forward 2 millimeters, that may be perfect for your sleep apnea, but I might need 10. So we have to titrate, follow these things. Sometimes you need follow-up sleep studies to see how you're responding to the advancement that's done, to know if you need more or less, or how to figure it out. So there's some upkeep and maintenance that comes along with it. And again, only going to help your oral airway. This is only moving your lower jaw forward. It's not going to help your nasal airway. So if you have obstructions in your nose and your mouth, or just your nose, this is not necessarily the best option for you. Alternative number 2 is something called a hypoglossal nerve stimulator. You may have seen commercials or come across something called Inspire. That's one of the trade names of a specific product that falls under the category of hypoglossal nerve stimulators. So these are devices that are inserted in your chest. So in this area, They have two leads or two series of leads. One comes down kind of in your rib area, and this helps monitor when you're breathing. When you're taking a breath in and your chest expands, this sensor senses that, and then it sends a signal along here up to the other lead, which goes on to your hypoglossal nerve. This nerve is responsible for movement of your tongue. So the reason it's called inspire is every time you breathe in, when you're asleep, this stimulates you to stick your tongue out. So you're sticking your tongue out, opening your oral airway when you're breathing in. So essentially all night you're like this. And it's been shown to be very effective in doing so because it's opening your oral airway. Again, one of the positives and negatives. So the positives, there's no materials and supplies once this is put in. So you're not really having any upkeep or maintenance other than it has a remote that you have to take with you wherever you go that you turn on, and then after a certain amount of time it stimulates it to come on, and it starts once you're essentially asleep, being the idea. Nothing hooked to your face, worn on your face, so no one necessarily knows you have this. It doesn't cause TMJ issues because it's not moving your jaw forward. It's still relatively new comparatively to the other options, but we have about a decade's worth of data on this that show that it's for the most part safe. Now, every procedure, every device can have issues, but there's not been anything shown that's inherently dangerous or problematic with this with regards to safety. So some of the negatives, well, it still requires a procedure. It's 2 incisions, used to be 3, down to 2 now, to put this in. So an incision in this area and an incision up here to put the stimulator on your hypoglossal nerve. There's going to be issues with the devices. Now, that doesn't mean these are going to have rampant problems, but inherently, if you bought the same electronic device 20 times, they're not all going to last the same. Some are going to have problems. This will be no different. And I don't know that we fully understand what the significance of that'll be because it's still somewhat new. The claim is that the batteries last about 10 years, and it's a very simple outpatient same-day surgery procedure to replace the battery. So it may end up being a very minimal thing where once a decade you replace a battery, and that's the extent of your maintenance. Other issues, you're sticking your tongue in and out all night. So if you have sharp teeth, if you have anything that's going on in your mouth, this could potentially worsen it. In orthodontics and orthognathic jaw surgery, we always worry about tongue thrust moving the teeth. And so if you're sticking your tongue in and out all night, it could potentially move teeth, cause open bites, cause problems. Again, there's been a few reports of this. It's not rampant. We just don't know as of yet. Wearing retainers or something else would be a pretty simple solution to that. There can be tongue irritation from just physically going in and out of your mouth. The muscles themselves get tired and sore. Your tongue can get sore. Generally, what's been reported is that those are kind of short-term issues and the patient adjusts to where it's really, you get used to it. It's not really a big deal in the long term. Surgical options that we offer mostly involve jaw surgery. The main one is something called MMA, which is short for Maxillomandibular Advancement, which means we move both of your jaws, your upper and lower jaw forward and typically counterclockwise. So we rotate them up and forward to basically open the airway. And this is just kind of an outline depiction here of narrower airway, move things forward, and generally you see even a bigger response than this, but this is just one that's outlined. So this is now bigger. Important distinction here, nasal airway and oral airway, bigger. And that's one of the main advantages of orthognathic surgery or MMA for airway purposes, is that it increases both nasal and oral airway, whereas every other aspect tend to only address one or the other. This does both, does it at a greater magnitude to where we know that other than doing a tracheotomy, cutting a hole in your neck directly into your airway, this surgery has been shown to be the most efficacious, the most effective, get you the best response and improvement in your OSA than any other surgery. So if you needed a surgery to help with OSA, and you needed to pick one that would be the most improvement, it would always be this one for what we have now. So positives and negatives again, well, there's no supplies. Again, it's a surgery. It's one and done. You have it done and it's finished. Nothing on your face, doesn't cause TMJ issues. There's no monitoring. There's no remote. There's no follow-up. There's no titration of how far do we move the device. And again, best proven surgical option outside of trach. Multiple airways or multiple levels of your airway are addressed, which is important because usually both are affected. And even if they're not, improving upon one that maybe not be the quote unquote problem, no harm. We would only benefit from improving it, so no harm done. The other important distinction that I love to point out because I think it's crucial is this is what's done when nothing else works. So if you have to make a decision of which surgery do I want or what do I want done, keeping in mind that this is what's done when the other things are done and they don't work well enough, I think is important because some people don't want multiple surgeries, multiple recoveries, multiple devices, whatever it is. If your goal is, I've got OSA, I don't like CPAP, I want to deal with it, I want to be done, this is a very good option for you. It is the best option we have. Negatives. It's a procedure and it's not necessarily a small one. People who want this, need this, generally do very well and are very happy they have it. But there's recovery time, there's morbidity, there's risk. The thing that tends to bother people the most is we tell them you can't chew for about 5 to 6 weeks while this heals. You can eat, you can drink, you can do whatever, but you just cannot chew for 5 to 6 weeks, which does bother patients. But in the grand scheme of life, what's 5 to 6 weeks for a significant improvement in a life-shortening disease? There are changes to your bite and facial changes, potentially. If you have a good bite and we're doing this, we're generally going to just try to keep your bite. So your bite shouldn't change much, but sometimes there's subtle changes. You might need orthodontia or some dental work to just correct it if it bothers you. And your face will change. We're moving your jaws. We're opening your airway. Things are going to change. So there's aesthetic things that we have to weigh and factor in when we're deciding how much movement and other things go along with this. So ultimately, this is the question you have to answer as the patient. And we as providers shouldn't be necessarily cornering you or telling you that something is better or worse for you. We should be presenting this in the way in which I hope I just did, and that, hey, you got options, but what works for you wouldn't work for me. My mentality is different than yours. My anatomy is different than yours. In a perfect world, we would examine your anatomy and then provide maybe more guided recommendations. So if you just have a nasal obstruction, an oral appliance is not going to help you. Inspire is not going to help you. Sticking your tongue out all night only is going to help your oral airway. A device that moves your lower jaw forward is only going to help your oral airway. So if your obstruction is nasal, those aren't good options for you, and we shouldn't be recommending them to you if that's the belief or where your anatomy stands. If you have both, then all options don't make sense either. Really, you're looking at CPAP and jaw surgery because none of the other ones are going to address your nasal airway. But if you have just oral obstruction, then you got a lot of options. And again, we have to be careful with that because usually the obstruction is oral, and if it's both, usually the oral is the larger component. But we don't want to look at it that way and miss a nasal component to where only once we've treated the oral component, we're now aware of the nasal component. So we do have to be careful, and that's where, again, CPAP can be a good diagnostic tool. And then jaw surgery, again, of being a little bit more definitive, because even if we're not sure, if we address both, then it becomes irrelevant. Personality and preference are huge here. Some people want to exhaust conservative options. I'll use CPAP for as long as I live. Great. I think that's a great option for you. If you can do that, do it. Do it as long as you can. Do you want to have one procedure and be done with it? Some people don't. Some people would say, hey, I want to start small and only work up if we figure out that we need to. Downsides of that are now maybe you have multiple procedures, multiple devices, and you end up doing what you could have done from the beginning anyways. And then do you have other concerns or do you have other conditions that maybe point us one direction or the other? So let's say you already have a bad bite or a malocclusion, you have a small recessed chin or a small face, some other aesthetic components that come along with this or TMJ issues. Those might point us some directions because we don't want to put you in an oral appliance if you have TMJ issues. If you already have a bad bite and would benefit from jaw surgery, well, two birds, one stone here. Let's address both of them. And then again, aesthetically, if you feel like you have the weak chin, weak jaw, small cheekbones, not prominent facial features, moving your jaw forward will help those aesthetic concerns while opening your airway. And that might be some of the determining factors that help you say, that's the option, that's for me, let's do that, let's go that direction. But again, we as providers should be educating you in these regards, examining your anatomy and realizing that it's not a panacea. What works for you doesn't work for someone else, and your both aesthetic, functional, personal preferences, personality preferences should always come into play when making this decision, and then go from there. And realizing as long as you're educated and make an informed decision, you have these options for you to consider. So with specifics to jaw surgery, who are good candidates? Well, if you have a lifestyle that you can't tolerate CPAP, you travel, you're single, you're young. Again, if you're 20 years old and you have this, you probably don't really want to be doing CPAP the rest of your life or carrying an appliance the rest of your life. I don't speak for you. You could want those things, but doing them indefinitely for 80 years essentially is not always, something that people like to do. If you have an existing malocclusion, again, you're going to need jaw surgery anyways or would benefit from it. Great. If you have severe OSA, so let's say it's just off the charts bad, sometimes CPAP is still useful, but sometimes the pressures are so high, the force that's required to get the air down becomes so high that it blows air out of your face. It's tough to get things to fit. The air leaks out in your eyes. Your mouth is so dry. Sometimes you would benefit from jaw surgery that if your severity is so high, even the jaw surgery might not make it to where you don't need CPAP. You might still need CPAP, but the CPAP itself is still so much more tolerable because now your sleep apnea is better and the pressures are lower. We would always want you to not need CPAP, but that's not always a reality based on your anatomy and severity. And then again, patient preference. You should have a say into your treatment. So if you just don't want CPAP or you don't want one of the other options, you should be able to say, it's my body, it's my money, it's my time, it's my decision. I want to have jaw surgery or I want to have Inspire or whatever it is. And that's just what I want. And we should be valuing that input. We should be welcoming that input. And it should, again, in my opinion, be the most, if not the most, one of the most important aspects of making this decision. So hopefully that was helpful about obstructive sleep apnea and treatment options for you. If you want more information, please, again, head over to azjawsurgery.com. Give us a shout. Email us, contact us if you ever want to make a consultation to discuss further virtually or in person. We'll be happy to do so. Have a good rest of your day. Thanks.